Hi, I'm Dr. Douglas Street. I'm a general practitioner in Montego Bay, Jamaica. Last time we spoke about diabetes. Today we want to speak a little bit about hypertension. Now, let us say that you are hypertensive, or you might have a relative with hypertension, or you might even be a health practitioner treating persons with hypertension. Or let us say you have somebody who's hypertensive and they're on medications and their blood pressure is normal. Doesn't mean that person is okay. No, not necessarily. Now, hypertension is usually diagnosed in persons with more than one readings of blood pressure of 130 over 80, higher than that, higher than 130 over 80 on different occasions, usually at least two occasions. And it is important because persons with hypertension have a higher risk of having heart disease, strokes, kidney failure, etc. So it's important to manage it properly. Now, there are two types of hypertension. We call it primary and secondary hypertension. And primary hypertension is when no specific cause for the hypertension has been found. And this is usually the case in about 95% of persons with hypertension. And you have a small percentage of persons where a specific cause was found. But what has been found recently is that those persons who have what we call primary hypertension, it's usually caused by what we call chronic low-grade systemic inflammation. Now, this means that you have higher than normal levels of inflammation in your body over a long period of time, and this actually disrupts the body's ability to control its own blood pressure. And so over time the pressure goes up and it can actually increase as time goes by. Now, hypertension is normally treated with medications which reduce the blood pressure. Unfortunately, most of the medications that are used to treat hypertension do not reduce the inflammation. And why that is important is because if the inflammation is not treated, then you find that the medication tends not to have what we call a mortality benefit. Now, that means that the medication does not extend your life. Now, can you imagine you are on medication and your blood pressure is okay, and your friend is also hypertensive, not on medication, and you fare no better than that person? That is actually what actually happens. So it is very important to first of all choose those medications that have a mortality benefit. And this information is readily available. Now, I've written a book recently called Beyond the Prescription, Reducing Inflammation, and it speaks about those medications which have been shown to have a mortality benefit. So you can actually purchase one of these books on Amazon. It's available in the ebook version and also the physical version. It also speaks about other measures which can be taken to reduce the inflammation in your body as well, such as diet and lifestyle, and taking certain supplements, certain nature-based supplements which have been shown to reduce inflammation as well. And the good thing about it actually is that you can treat your hypertension without medications by reducing your inflammation. The thing is, it doesn't really work as quickly. So there are some persons who may have to combine medications along with these measures. Right? Now, it's also important to understand that there are certain medications, because of the impact they have on inflammation, are not suitable to be used long term in persons who are hypertensive. For example, even though some pain medications are called NSAIDs, in other words, non-steroidal anti-inflammatory drugs, because they have a negative impact on your intestinal bacteria, this can actually increase the levels of inflammation inside of your body and can increase the risk of complications. That's why it is not recommended that persons with hypertension are treated for any prolonged period of time with non-steroidal and anti-inflammatory drugs. These include ibuprofen and diclofenac. There are other medications that also have a negative impact on your intestinal bacteria, such as certain medications that are used to treat stomach problems. And so these should really be avoided when in treating persons who are hypertension, especially for long periods of time. Now, there's more information that you may need to get. So make sure that you get the book. Also, make sure that you subscribe to my YouTube channel to get further upcoming videos. So, take your health in your hands and improve your health. Take care.